Yeah, cancer is the leading cause of death worldwide, and based on Canadian Society of Cancer, around 200,000 new cases are reported every year, and more than 29% of deaths in 2016 were cancer related. There are some challenges in treatment of cancer patients. For example, for drug which are already in the market, their side effect may cause patients to discontinue taking their medication. Some patients may also show resistance to the drug, which cause failure in treatment. For new molecule, challenges will be the same, and in addition to side effect and drug resistance, we need to find a safe way for drug to be administered. Among the different mechanisms that cause cancer cells to resist therapy is the role of Pnkp enzyme. This enzyme can repair damaged DNA. A83B4C63, that from now I will call it A83, is a Pnkp enzyme inhibitor that can prevent damaged DNA to be repaired and makes cancer cells more sensitive to radiotherapy and chemotherapy. But it may do the same thing in normal cell. It also has a poor water solubility. So in addition to tumor-targeted drug delivery, we need to overcome its low solubility for IV administration of this drug. So previous studies show that polylactide and polycaprolactone-based polymeric micelles have shown that they have potential to solubilize, sustain, and targeted drug delivery. Based on that, the objective of this work was to prepare and characterize micellar formulation of A83 using polylactate and polycaprolactone, PCl and PBCl, to measure the in vitro drug release during 24 hours and to determine pharmacokinetic parameter of micelle versus micellar formulation versus control formulation of A83 in dolly rats. For control, we used both chemophore and PEG 400. Chemophore is a non-ionic surfactant, and in pharmaceutical industry is widely used as emulsifying, solubilizing, and wetting agent. As there are some reports that chemophore is not an inert ingredient, we also use PEG 400 as another control because a report shows that it may change the pharmacokinetic profile of some drugs. So we encapsulate A83 in polymeric micelle using the co-solvent evaporation. And based on polymer to drug ratio, we came up with 4 formulations. Then we measured the size and polydispersity of the formulation using the zeta sizer. We measured the encapsulated drug, the encapsulation efficiency, and drug loading by using the HPLC. The result of our measurement, the size and PDI, as you can see in the right side, the PDI, we didn't see any difference between PDI values between micellar formulation, while the size in the left-hand side, you can see that PBCl and PCl were significantly smaller than polylactide micelle formulation. Regarding drug loading and encapsulation efficiency, as you can see, PBCl and PCl resulted in higher drug loading and higher encapsulation efficiency when compared to polylactide formulations. Then we conduct a release study and for control, we dissolve A83 in PEG 400 and in cremophore. And we had for micellar formulation, we use dialyzed bags. We use BSA 4% as a media, and in 37 degree, putting in shaker, and we took samples up to 24 hours. The release result, as we can see here, we saw that PEG, the red one in the top, and the blue one, cremophore, showed a significantly higher increase rate compared to for micellar formulation. So micellar formulation show less release during 24 hours compared to control, but there was no difference between the four formulation. So based on the result that we got from drug loading, from size of the micelle formulation, PDI, and release profile, we move forward for an in vivo study using PCL and PBCL for making micellar formulation in compared to controls. So we used dolly rats, and we divided them to 4 groups, 4 animals in each groups. The 2 control, the PEG and cremophore, and 2 micellar formulation, PBCL and PCL. We gave them 10 milligram per kg IV dose, and we collect blood samples up to 72 hours. We separate plasma and measure the level of A83 by LC mass. The result, as you can see here, for the first 4 hours in concentration times curve, we didn't see any difference between micellar formulation and controls. But if we look at the whole profile up to 72 hours, you can see that cremophore, and which is the red one, and PEG 400, which is the green one, we couldn't detect any drug after 6 hours. But for PCL, you can see, which is in black, we could detect drug up to 48 hours. And for PBCL, which is in blue, we could detect drug up to 72 hours. So all of this together shows that these 2 micellar formulation can stay for a longer time in the body. We also measure the pharmacokinetic parameters, C0, which is concentration at time 0. We didn't see any difference among the groups. AUC, which represent the systemic exposure of the body to drug. As you can see, we didn't see any difference between groups. Half-life was significantly longer for PCL. Clearance, which represent the rate of drug removal from the body, we didn't see difference among the groups. And MRT, which represent average amount of time that drug stay in the body, shows significantly longer in micellar formulations in compared to control. So my key messages from this study that I need to thank NMIN for supporting us for this research are, first of all, PBCL and PCL can consider as a good solubilizing carrier for IV administration of drugs like A83, which are poorly water soluble. They can increase biological resistance time of A83 and prolong its circulation. And also they can prevent toxicity reported by cremophore. As I mentioned at the beginning, cremophore is widely used in pharmaceutical industry, but there are some reports regarding nephrotoxicity, cardiotoxicity, and even anaphylactic reaction following administration of cremophore. So it shows that PBCL and PCL has the ability to solubilize drug, and we don't have to use cremophore. Thank you.
Excellent. Thank you very much, Forugh. And then I have actually two questions for you. The first is, could you explain why you used two control groups?
Yes, and the reason that we chose to control was the fact that chemophore is not an inert ingredient. It can affect on protein bonding of some drugs. It can affect on the metabolism of some drugs. So in fact, the concentration times curve may be affected by chemophore. So we thought it's better to consider another option, another ingredient which is not affected, affect on the drug distribution and pharmacokinetic. So we choose PEG 400 as well to see if there is any interaction between A83 and chemophore.
Great, thank you. And what do you think the next steps for this project are?
Well, I think the best question that needs to be answered is, we saw that the drug stay longer for longer time in the body. We saw that the half-life increased, but we didn't see any change in clearance. So we thought probably drug it's going to maybe we need to look at the distribution of the drug. So I think in the next step, we'll be doing an animal study, collect all the organs and see what's the distribution of the drug in other organs. It gives a lot more information regarding this drug. I think it's a good move on for the next step.
Excellent. Thank you very much.